Hi, and welcome to the show where we share stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/podcast. Today in the show, we have Diane Birnbaumer. She is an emergency physician. Her Kevin MD article is titled The Impact of a Single COVID Infection. Diane, welcome to the show.
Oh, thank you so much, Dr. Poe. This is just a delight. I've been reading Kevin MD, I think since you started. It's been a long time, and I appreciate what you've contributed to our world in medicine. It's wonderful.
Thank you so much for reading and for appearing on the podcast today. And we'll get into your article in a little bit, but first off, just briefly share your story and journey to where you're at.
I'm a native Southern Californian, the only physician in my family. I'm not sure exactly where this came from, this idea of being a doctor, but it was quite some time back. I board certified residency trained in both internal medicine and emergency medicine, but EM is really where my heart is. So I've been practicing emergency medicine in LA at a level 1 trauma center in the county system for 30 years and watched lots of residents go through, taking care of gajillion patients, and watched the healthcare system from that vantage point, which is kind of a raw vantage point about the healthcare system in general. Love my job, love the teaching, love the residents, and it's just been quite a journey. I'm delighted to have the opportunity to be able to do this.
So tell me about the evolution of emergency medicine and what's the state of emergency medicine today in October 2022?
Oh my gosh, it's really changed a lot in my 30 years. It went from, it formed itself 50 years ago as a specialty, and it decided what it was going to be, the 24/7, 365, white hat, everything comes through the door. But what's changed is extraordinary. And like everything in medicine, right? The external pressures of all the sort of things that hoops we have to jump through, and all the insurance issues and all of that. But just watching the breakdown of the healthcare system happen from our viewpoint, because we are where everything can end up. If people can't get access to care, or doctors' offices are full, we're where we see it all. We see where the opiate problems are. We see where the alcoholism problems are. Teenage suicide issues, mental health issues are all in our face every day. So it's an interesting vantage point to watch what's happening in society and in healthcare from the emergency department. Is the place that everything ends up at some point in time. So it has changed a lot. And I think emergency people who work in ERs really see the problems in the healthcare system.
And right now, what are some of the biggest challenges facing emergency medicine?
I'll tell you, staffing is a huge one right now. It's always been busy. That's why most of us go into it, right? We kind of like that crazy atmosphere. But right now, staffing is making things, I think, frankly, dangerous in some places in the country where people are just getting seen in the waiting room because there's no room in the back, and because there's no room upstairs because there's no staff. It's been a problem for a long time.
Are you talking about specifically nurses, support staff, physicians?
Yeah, it's nurses, I think, in particular, but I do know that there's been a pretty significant exodus of emergency physicians over the last couple of years. A lot of people thinking of leaving, and that's impacted staffing. There's just no question. Nurses in particular, though, I will tell you, we all know, anybody in medicine know, the nurses are the backbone of healthcare, without question, the unsung heroes, 12 ways from Sunday. And I don't blame them for leaving, but boy, it leaves us really thin.
Why are a lot of emergency physicians, just from your opinion, why are they leaving the practice?
It's always been a hard job. I think what's happened during the pandemic has really undermined how people feel valued. The idea that they're why they're there could even be questioned. They're there because they want to be there to take care of people and to watch people die who they don't feel need to die. And to really be on the front line during a pandemic, which is not something anybody signed up for, has been really hard on people. Initially, no PPE and all the things that you read about in the paper, they lived it. They lived it, as did our critical care colleagues and the people who were in the hospital. And I think it just has taken people to a brink where if they don't feel valued, what's the point? And so I think there's at least a lot of people considering, and I've had colleagues leave who had 10 or 20 years left in their practice and they just hung it up and are just going to go do something else, which is heartbreaking.
All right. So speaking of the pandemic, you wrote a Kevin MD article back in September titled The Impact of a Single COVID Infection. Now, for those who didn't get a chance to read your article, just walk my audience through it, share the story why you decided to write it.
Sure. So what I had been lecturing on COVID virtually I'd done 40 or 50 lectures to keep people up to date on the COVID as it changed so fast. And part of that was being on top of the vaccines and what the virus was doing. And so my husband and I, who's also a physician, were all in on the vaccines, maxed out on the vaccines, really tried to live our lives as safely as possible, not crazy safe, but just keeping track of where infections were, the hospital beds open if we were going to be traveling and we got sick, were the medications available, et cetera. And we decided to, like a lot of people, take measured risks as things got more reasonable, at least more predictable. And in taking the measured risk, we went out and took a trip and I got COVID. And what was amazing to me, this is just in August, just a couple of months ago, but what amazed me is how this you do you, I'll do me approach that we seem to have settled into isn't just you. one person's infection trickle down was amazing to me. And besides the fact I had to quarantine and all that other, isolate from my husband, whatever. He never got it, by the way. I just was flabbergasted how many people I might have exposed, which has always been my nightmare. The last thing in the world I want to do is get somebody else sick. And I just exposed people that I felt terrible if they had gotten. Fortunately, nobody did get sick, but I would have felt awful if they did. And then the thing that struck me the most was how one person's interaction with the world, I was supposed to lecture at a conference and I couldn't go. I was supposed to get help childcare with our grandkids. I couldn't do that. That one person's illness trickled down to probably, I don't know, dozens of lives at least. And multiply that times how many infections a day. It just, the impact of this you do you, I'll do me thing struck me as just vast and unmeasured and unaccounted for in all of our measuring deaths and hospitalizations. And this is something that I don't think has been factored in. I think it's part of the staffing shortages that we're seeing and all the other sort of stress that we're seeing out there with people's incomes, et cetera. So it just struck me as a remarkable thing what one infection can do.
So give me a sense. You mentioned a few examples, not being able to care for your grandkids and not being able to go to this conference. So if you were to estimate, how many people did you affect from your single infection?
Oh my gosh, probably of exposing people, it was probably 24. If you go to the registrants at this conference, there were over 100 people who came to this conference expecting a certain panel of lecturers, didn't get that panel of lecturers, got things scrambled at the end. Probably in my work and personal life, it was probably 100 people overall that got, at least 100 people got impacted.
So what would you do differently? Because we're now talking in October 2022, and the world that we have now is certainly different from what it was last year, the year before. So what would you do differently?
You know, I'm not sure there's any way to rein this in, which makes me really sad. I just got back from our national meeting where, at least for the meeting, we had to attest to being vaccinated and to having gotten tested, antigen testing the day we all signed, you showed up for the meeting. But there weren't a ton of masks being worn in thousands of people at a meeting. I just think people, for whatever reason, and many are legit, some are questionable, whatever, it doesn't really matter anymore. I think this horse is way out of the barn. I do wish people were a little more nuanced and could ramp up if things got worse, which I suspect they will in the next couple of months, do some things like masking and then back down a little. But it's just gotten incredibly polarized and people are dug in. For whatever reason, I think they're dug in. So I don't know if anyone can influence this now. I would love everyone to get vaccinated who can. I know people won't. I would love everyone who is at risk to mask and take care of people around them who are at risk. I wish we could step back into being a little more compassionate and caring of each other instead of digging in, but that doesn't seem to be what we're doing right now.
How much of that is just American society and our kind of divisive, polarized political environment? How much is it is that?
I suspect there's a big impact factor of that. It is a shame to me. I don't think of Americans as being so dug in and self-oriented, and maybe I'm naive. I just thought of, when 9/11 happened, we were the most united I've ever seen us as a country, maybe because it was an external sort of threat, but COVID is an external threat. And I'm just sad that we can't get together. And so I suspect this is threaded through everything that's around us, politically, personally. And we just, some people don't even talk to people in their family anymore because of all of this. I just think it's emblematic. It just happens to affect those of us in medicine and anyone who doesn't want to get sick. It impacts that dramatically.
So do you ever encounter this in the emergency department? Someone has COVID, perhaps they're resistant to vaccination. Do you address this when you see them in the emergency department?
Yeah, it's interesting. So this is something that I think most practitioners do. I think most people who are practice medicine, if they haven't given up, do at least mention, especially in the high-risk population, that vaccinations are available. It is a hot button, though, and I think that it's like touching a hot iron. Most people, I think, I know I do this as well with friends and family, if the subject is brought up and it is clear the wall comes down, I honestly don't see the point anymore. Just, it saves lives, there's no question. It stops hospitalizations, there's no question. But there are just people who believe what they believe and they just will not talk about it. I just don't want it to trickle out into all the other vaccines, because that would be just tragic to see measles back, and we've already seen polio back. That, to me, to have that expand to those other illnesses would be absolutely tragic.
So tell us a success story. Give us some hope. Tell us about a positive interaction that you've had either in the emergency department or with friends where you talked about vaccine and you changed your minds.
Actually, what the funnest thing, my husband is adopted, and we found his family through 23andMe randomly. It was just one of these crazy things that happened. And they're family members that are not anti whatever, but they're just a little more conservative approach to everything. And it's been really fun to talk to them and watch over a year of having now this new family member, their now brother and nephew, who is a physician, watching them listen to two physicians talk to them every Monday and watch their evolution of how they think about medicine and how they question everything in a way that's actually really positive. It's educational, and that their minds are changed logically and thoughtfully instead of reactively. It's a response, not a reaction. It's been extraordinary to watch this happen. And they talk to their family members there. And I think that's the thread of this that is so potentially positive. And that's been a great success story to watch this interaction change over time. They're wonderful people, and it's just been extraordinary.
So you mentioned some of those people who are dug in, right? Where you feel the walls come down. Do you just leave it alone? What do you do in that situation?
I really think it depends on the situation. And a high-risk person, I really think it's worth the effort to find the ways to convince people. If you read the literature on how to convince, don't talk numbers. They don't want to hear numbers. They want to hear stories. So they want to hear, I knew someone just like you who had multiple myeloma, and the vaccine really helped them keep them from being in the hospital, or it took multiple vaccines, but they were able to get immune. To tell stories to people is really what convinces them, making it personal. I think telling stories is what physicians do best, because we know them. We can relate to something in what we do in our practice to that individual patient. So those are the things that seem to be the most convincing, I think, is to really take the extra effort in the high-risk people to really make sure, or people that have high-risk people in their lives, to make sure that they don't, God forbid, infect someone, and that they have their loved one be the most protected possible.
We're talking to Diane Birnbaumer. She is an emergency physician, and her Kevin MD article is titled "The Impact of a Single COVID Infection." Diane, if you were solely in charge of public health right now, this podcast is going to come out probably end of October, beginning of November. What exactly would you do right now?
My heart goes out to public health officials. They've become that having a public health degree now seems to be painting a target on people, which is really tragic to me. But to be a pure public health person, the variants are changing. We now have a variant soup out there. We don't have just one to the next. We now have all these little offspring of the variants that are out there now. And we have a variant soup that is definitely out there. And if people really want, we're going to be close together, we're going to be enjoying our holidays. If people could just take a deep breath and realize they can still enjoy things and do the things they want to do, but do it in a safer manner, please get vaccinated. Wear your masks when you're in crowded spaces. It's not fun, but it's safer, and that way people don't get sick. If I were a public health official, I would really urge people to make sure that vaccine, which is not getting taken up at all, please go get vaccinated, and please do your best to not infect others or get infected yourself. And masks really help with that, and they do. You're going to find somebody to say anything anywhere right now out there. You could find anybody to support what you want, but the reality is masking done right works.
And my final question, what are some of your take-home messages that you want to leave with the Kevin MD audience?
One thing I really want the Kevin MD audience to know is I never in a million years thought that I could send something to you and have you put it out there for other people to read. And I find reading what you put on your site very eye-opening and heartbreaking and joyful. And so if you have a story, to tell it to your family, tell it to your friends, write it down, send it somewhere, maybe even Kevin MD, but the stories are so important, and you have so many. Your listeners have thousands and hundreds of thousands of them. Share them. That's our humanity, right? That's what we can share.
Oh, thank you so much for those kind words. Thanks again for sharing your story time and insight, and for being on the show.
Thank you very much.